Okay, so the first test we're going to look at is called the Lachmann test, and that is to assess whether or not there is an ACL injury. In order to perform this test, you are going to place the patient's knee at about 20 degrees worth of flexion. We usually would have an adequately long table, so bear with us today. About 20 degrees worth of flexion. With your left hand, if it's for their right leg, you want to stabilize their right femur, the distal end of it, with your hand. And then you're going to place your right hand at the proximal end of their tibia. So now that their knee is in 20 degrees of flexion, you are then going to bring the tibia forward, and you're assessing for an end point. You see that his tibia is stable and it's not really moving because his ACL is intact. However, if you experience a lot of laxity and are able to freely move the tibia forward, and you don't feel that end point per se, then you know you're dealing with an ACL injury and probably should get an MRI.